अब आ रही है आवाज आपको? ओके
जी मैम, मुझे तो आ रही है, बस आ रही है।
हाँ, so general principles are pregnancy doesn't alter resistance to infection. Severe infections have a greater effect on the fetus, and the maternal antibodies crosses the placenta. These are some general principles. You have some idea about it. That during the pregnancy, there is not like this infection. If anyone gets, that will alter her resistance. No, not at all. Even in the pregnancy, as we know that it is the immunocompromised status, patients are more prone to develop infections. Similarly, if patient is having severe infection, it will have definitely severe impact to the belly, it will have different kind of the congenital abnormalities, and antibodies can cross the placenta. Yes, maternal antibodies cross the placenta, and if it crosses, it can cause the infection. What is the infection from the mother to the baby? So basically, there are different parties. One is sending from the genetics, everything is straight to the placenta, and the baby is seen from the baby to the uterus, and the other is the accidentally at the time of the we start to perform any procedure during the pregnancy, like some patient may require we just diagnose some gynecological abnormalities for this amniocentesis. So for these things we have need of the there's also chances of the transmission of the infection. Fetus and infection. Indirect effect and there's a direct effect. Indirect effect means oxygen as transport and nutrient exchange by this, and the direct effect invasion of the placenta that can lead to the infection to the fetus. Now,
your voice is not clear.
आवाज क्लियर आ रही है?
नहीं.
मैम आपकी आवाज ठीक नहीं आ रही है बिल्कुल भी.
मेरी आवाज सही क्यों नहीं आ रही है? इट्स माय क्वेश्चन. मैं तो बिल्कुल ठीक बोल रही हूँ.
मैम आप लैपटॉप यूज कर रही हैं, लैपटॉप के थ्रू कनेक्टेड है?
जी मैं लैपटॉप के थ्रू कनेक्टेड हूँ. मैं लैपटॉप के थ्रू करीब
अगर पॉसिबल है थोड़ा सा माइक करीब कर लीजिए, यानी थोड़ा सा लैपटॉप अपना और करीब कर लीजिए प्लीज.
What does infection can cause during the pregnancy? There are the different lethal effects of the infection that can occur during the pregnancy. If a lady is having an early week pregnancy infection, she can have a miscarriage, and onward we can have a congenital anomalies, fetal growth, intrauterine fetal death can occur, and the preterm and the preterm delivery. These all are the risks. These all are the factors that can occur because of the infection. Which infections can occur during pregnancy? There are the different number of the infections if we talk about. Not only the viral infection, even bacterial infection can occur during pregnancy. But the most important way we are going to discuss, like Parvovirus, Parvovirus, Bacterial, herpes, hepatitis, HIV, and measles. These are the different type of the virus that can cause the infection during the pregnancy. Let's discuss the first measles. As you know, the measles, the start of the infection occurs by the Parvovirus. And the important thing you have to remember when you just go to the chapter, that you must know if there's a, let's suppose, measles infection, what would be the organism it can cause, and what would be the incubation period of it, problem, and what are the measures we have to take during pregnancy and during the pregnancy and that time of the intrauterine delivery, and which areas we have to give to the patients and what medication is available. The simple, these all are simple things we have to go through it. So, if we are talking about measles, in the measles, it's the only incubation period is 10 to 14 days. And here again, need to screen the patient if it is possible to develop the pregnancy, and make sure that the patient is vaccinated against the measles. At the time, if we have an EPI program, that we give the measles vaccination at 9 months of age, and again, there's a at the age of 15 months child. Okay. If patient is having infection during the pregnancy and she is symptomatic and coming to in your clinic, so definitely, first of all, she is having the viral infection, so you have to keep this patient in isolation, and just we have to manage according to symptomatically. If symptoms are not severe, mild are symptoms, then definitely accordingly we will manage. If she is having the severe symptoms and also developing the secondary infections by the other bacterial infections, so there's a need to give the antibiotic too, along with the antiviral treatment. At the time of labor and delivery and postnatal, again, there are some specific precautions you have to take for this patient. And for this patient, from first day of admission, at the time of the delivery, even after the delivery, there's a need to keep the patient in isolation. Come to the next infection, that is the rubella. Again, we know that rubella is caused by the Parvovirus, and this rubella is very important one of the infection, because as you know that even in our clinic, you have observed this thing that usually we advise the patient about the three infections here for screening purpose. That is the rubella IgG and the hepatitis B and the hepatitis C. So ideal universal screening, we will talk about the universal screening. There are the five, infections you have to screen for the patient. Three are the rubella, hepatitis B, and the C, and two others are the syphilis and HIV. But in our country, we just do only rubella and B. So, if you come to your clinic, you have to advise her rubella IgG. If it's positive, then definitely she's immunized against infection in her body. There are antibiotics against the infection, so there's no need to get worried. But if she's having rubella IgG negative,
Excuse me, ma'am. मैम सॉरी फॉर इंटरप्शन, लेकिन स्टूडेंट्स ये कह रहे हैं कि उनको ऑडियो बिल्कुल क्लियर नहीं हो रही है, तो
ऑडियो क्यों नहीं क्लियर हुई यार? मैंने लास्ट टाइम इसी पे किया था, आई एम रियली सरप्राइज, क्यों नहीं हो रही है ऑडियो क्लियर? फाइनल ईयर को मैंने एसी नहीं दिया है, हर चीज क्लियर थी, आई हैवंट डन एनीथिंग। आप बताइए क्या करूं?
अगर मैम प्लीज आगे आ तो
ऑडियो। जी जी बोलिए।
प्लीज माइक थोड़ा सा करीब कर लें। और
कितना माइक करीब करूं? अच्छा सही है
मैम, चाहे तो आप अपनी वीडियो ऑफ कर सकती हैं, इफ यू वांट, स्टॉप वीडियो करके और करिए।
Okay, so let's discuss about the rubella. So rubella has got the incubation period of 14 to 21 days, and the rash that is spread. What kind of the rashes occur in the rubella? Yes, every infection has got the different pattern of the rashes to appear. In the rubella, rash that spreads from face to trunk and extremities, lasting about 3 days, and there occurs the fever, athalisia, post-articular, posterior cervical lymphadenopathy. These are some specific features of the rubella. So again, here pre-pregnancy, what you have to advise during the pre-pregnancy? Yes, you have to screen if patient is coming before pregnancy to you and she wants to conceive, then advise her that she should get done the rubella IgG screening drug. If it is positive, then there is no need of any kind of the vaccination. But if it is negative, then it's better time to give her first a vaccine against the rubella, and then keep her for at least 3 months for in contraception, and then advise her to conceive a pregnancy, because rubella vaccine has got it is a live vaccine and it has got the teratogenic impact on the fetus, so it will be a nice decision to conceive during that time. Anyway, so next prenatal, what would we will advise to the patient? Again, if earlier during pregnancy we haven't checked the immunity status of the patient, then again here we will advise the patient for the immunity status to check it out, screen the patient. If maternal infection is confirmed, so option will depend upon the gestational age at the time of the infection. Yes. Now here again I will discuss that if patient is having a severe symptoms, then you have to advise accordingly. If she's having mild to moderate symptoms, we will advise accordingly. if rubella basically it's a kind of a very lethal kind of infection, we can say, because it has a very harmful effects on the baby. What is the causes? It causes different kind of abnormalities. Along with this, there is a congenital rubella syndrome can occur. If patient presents to you before the 16 weeks of the gestation and she's having the history of the rubella infection and having symptoms also, so I think it would be a nice decision for this patient that she should go for the admission, because there are more chances the baby can have the different kind of abnormalities or congenital rubella syndrome. So if she's having, she's presenting to you before 16 and having infection before 16 weeks of gestation, in the first trimester and after 16 weeks, then we will go for the admission. But if there are sometimes we associate the patient who comes taking at the third trimester, so in such patients, still there are the chances to transmit the infection, but not like in the first trimester. As in the first trimester, more than 90% chances the baby can have teratogenic effects, while in the second or third trimester, it has been observed that only 5 to 10% of chances the baby can have some teratogenic effects. Okay, so if develop infection in first trimester, then you are the termination of the pregnancy. Let's discuss what is the congenital rubella syndrome. Yes, congenital rubella syndrome, there are the different effects. If we are talking about the eye, in eye the baby can have the cataract, retinopathy, microphthalmia, glaucoma. And if we are talking about the heart, in heart abnormalities, baby can have the PDA and the pulmonary artery stenosis, the AST and the VST. These are the different kind of abnormalities baby will develop. In ear also, injury to the cells of the middle ear leading to the sensory neural deafness. So specifically in congenital rubella syndrome, it affects eye, heart and the ear. So this was about the rubella infection. Now come to the parvovirus. Parvovirus is not such a common infection. There was a time it was common, but now not at all. But if it occurs, it has been observed that it occurs mostly in those patients who work with little kids, with children, especially school teachers. Well, it occurs because of the human parvovirus P19 and its incubation period is 4 to 14 days. And in this infection, patient usually develop high blood fever, slapped cheek syndrome, arthropathy, bone marrow suppressions can occur. What could be the effects of the parvovirus in the fetus? Again, there are the hydrocephalus can occur, and even the miscarriage and mother multiple congenital abnormalities can occur in case of the parvovirus infection. Same precautions you have to take even in the parvovirus infection at the time of the labor and the delivery and as well as in the postnatal. Okay, and you have to include in any kind of the infection, infectious control disease measures you have to take. So ID should be with you guys. Whenever you're going to manage any patient with infection in the pregnancy. Come to varicella. Most of the people you know about this infection, varicella. Yes, it is the chickenpox. It occurs because of the varicella zoster virus. Its incubation period is 10 to 20 days. And in this condition, patients have a fever, rash, pneumonia, pericarditis, myocarditis, and these are the symptoms. Okay. Yes, this infection is also lethal, not only for the mother, also for the baby, but it can be very lethal for the mother too. Mother can die even by this infection if it is not treated timely, because one patient because of this infection developed the pneumonia, and this pneumonia can be in a severe state and become at the end this legs become totally fibrous, and lady can die because of this infection. So it's very important once to diagnose the chickenpox, keep that patient in isolation and start to treat properly and immediately. What consequences can occur to the baby? Yes, the most common one, that is the congenital varicella syndrome. And again, here there are some specific features baby will have. They can have a fetus can have fetus scarring, limb hypoplasia, convulsions, cataract, and chorioretinal scarring, cerebral particle atrophy, and micropeptide. These are the features in case of the congenital varicella syndrome if baby is having. If mother is exposed to the infection, So first of all, if she comes to you and she's giving you history that Dr. Saab, yesterday I met with my friend and she was having the chicken pox infection, and my contact with that girl was about 1 or 2 hours after this, and we just were, staying at the same room. So whether I will get this infection or not, might be she has that query and she presents with such sort of the complaints. At that time, you have to mention her. You have to do number one thing. If she is having, you must know. In case of the chicken pox, if she is having history of contact more than 15 minutes, then it means there are more likely chances that lady can have the chicken pox infection too. So you have to screen the first of all that lady. So for screening, again, you will check the immunity status of that patient. And if her IgG negative, then you have to give her very sick antibody within a 96 hours of the exposure. You have to immunize this lady. But if her she's having negative and she has started to develop the symptoms and the symptoms are getting worse, so what could be the consequences for this patient and for baby? Definitely, the baby, if the mother develops chickenpox, you have to tell her each and every fetal risk that the baby can have the also different kind of congenital abnormalities, and you have to keep this patient again on the isolation ward, and you have to start antiviral treatment, that is the acyclovir, and you have to monitor the special patient part that she doesn't develop these symptoms of the pneumonia, because I told you once she will develop this pneumonia, that would be very lethal for that patient. At the time of labor, delivery, and the postnatal, again, same measures of the infection control, and at the time of the birth, you have to properly evaluate the baby, and that would be, baby evaluation will be done by the pediatrician. Come to the next infection, that is the hepatitis B virus. Everybody knows about the hepatitis B virus and their immunization also. If we go for the how does it transmit and what are the chances, intrauterine infection 5%, and the intrapartum, at the time of delivery, there are definitely 95% chances that this infection can transmit from the mother to the baby. So far, we have need once baby get delivered, the mother who is having the hepatitis B positive during the pregnancy, you have to immunize the baby within 72 hours. Yes. So if you are talking about the immunization, you are guys hopefully very well know about in hepatitis B, we give the passive immunization as well as the active immunization. In the passive immunization, initially just we give it, and the active immunization, there are these step-wise we just give from the 0, 6, and 12 months like this. But passive immunization, we have to give it within 72 hours, because it will help the baby to recover from this infection as soon as possible. Now, again, similar to other infections, there is a need of support care and the universal screening of all pregnant women, as I discussed earlier in the first slide, that universal screening we do here for the hepatitis B, hepatitis C, and the rubella IgG. Labor and delivery, again, there are the need to take a precautions, but it is not such contagious disease that we just bear the patient like chickenpox or like measles. No, not route of the delivery also doesn't include vertical transmission. If we are going to deliver the baby by the normal delivery, again, same chances of transmission of the infection, or by cesarean section, same chances of the transmission of the infection. Postnatal, we have discussed regarding the immunization. So first, we need to give her basic immunization as soon as possible. So these were some infection which were the viral infection which we discussed now. Now come to some are the bacterial infection. They can also occur during the pregnancy. These are the group B Streptococcus GBS, very lethal kind of infection. Everyone knows about it. Since their specific screening is available for the GBS. The GBS, it can cause sepsis in the neonate, and transmission can occur from the time the membrane rupture or at the time of the delivery. For the screening of the GBS, RCOG green dot guidelines has, and there's the evidence that for GBS, you can go for the routine screening if patient is having any history of during the pregnancy of the GBS. So what we do the hydrogenous for the mother. She's having infection, any infection like a GBS. Then we just also again screen that patient at the just before to the clinical features. What could be clinical features in case of the GBS? Again, if baby is getting infection from the mother, the baby can have the neonatal sepsis. Baby, there's a chances baby can suddenly collapse. The baby can have tachypnea, nasal flaring, and the poor tone and shortest baby can have. For management of the GBS, again, these babies monitored by the pediatrician in the neonatal ICU care, in ICU. And for GBS treatment, we are going to talk about GBS treatment. GBS treatment, everybody knows about it, the broad spectrum antibiotic, that is the Parvovirus cover we give at the intrapartum time and to the mother. It is the prophylaxis both is available. I think it's beyond your level. There's no need to remember that dose regime for it. Anyway, so the thing you have to remember that how much chances of the mother she can have the GBS infection, and how does it impact, and what could be the consequences to the baby if mother is having the GBS. So once GBS is screened, the most prime responsibility is that we should screen up to the time of the birth of the baby, and if baby is having these GBS positive, the keep in eye the baby, that baby doesn't develop any kind of such symptoms, and give antibiotic cover for 5 to 10. Along with the GBS, there is the Chlamydia and the Gonorrhoea infection. These both infections definitely are sexually transmitted infection. They both have also very lethal effects during the pregnancy, particularly having the Chlamydia or Gonorrhoea infection. There are the chances the patient can go in the preterm labor pain and the pre-prom, and baby can have a low birth weight, and even the FGR, fetal growth restriction, can happen by the sexually transmitted infection. How to treat these kind of patients? Obviously, once you have diagnosed that the patient is having the infection of the Chlamydia, so there's the best drug of the choice is the azithromycin or erythromycin you can advise. And if she's having the gonorrhea, so then again broad spectrum antibiotic, that is the cephalosporin, you can go for it, and both have got the very good effects. The purpose of this whole presentation, and just to tell you this thing, that if you must have idea about each and every kind of the infection, how does the viral infection behave, and how does the bacterial infection, and when we just take the precautionary measures for the patient, and what are the advices we have to give to the patient. So now if you go through for the infection in pregnancy chapter in your book, 10 measure, so you must go for their patient here, what kind of the they cause this infection, and again what could be the clinical features, how does the patient present during this infection, and then how we can diagnose the patient, what are the screening measures, tests are available, and once patient is a positive any kind of the infection she's having, then what could be the other measures we have to take for her, and which are the specifically advices for the patient we have to give her, because a lot of the infections are such kind of contagious that the patient has to live isolated. If she's not getting even admission at the hospital, she should stay at the home if she's having mild symptoms, but she should live alone. She doesn't have a contact even with other pregnant ladies, because these kind of infections, such contagious, that can be spread so fast. So these are the very important